Thank you, Concorla. I am pleased to be here on behalf of the Minister for Health this evening on the first day of the spring session for a second stage of the Health Service Executive Governance Bill 2018. As we look forward in 2019, there are opportunities that we need to grasp and challenges we need to understand and control. This bill, with the re-establishment of a board for the HSE providing independent oversight, is a key enabler of accountability, improvement and transformation in our health services. The Minister for Health and I can think of no better moment than the start of a new year to work in collaboration with colleagues across the political spectrum to deliver on the commitment across this House and has signed up to in Sláintecare to re-establish the board of the HSE. The HSE is our largest state agency with a budget of over €16 billion in 2019 and a substantial workforce delivering vital services. The transformation vision for health sector reform, as set out in the Sláintecare implementation plan, is an exciting time of opportunity and change in our health services. However, with this opportunity also comes a significant amount of risk, responsibility and work for the HSE corporately. The HSE must be supported to deliver this work on the ground, and in the Minister's opinion, it is essential that a strong board is established to drive the strategic direction of the organisation, ensuring that appropriate systems for management and performance monitoring are in place, and to ensure accountability to the people of Ireland for decision-making processes in the HSE. The board will also support the HSE in its decision-making capacity in order to ensure transparent, collective, evidence-based decisions in relation to the range and breadth of health and social care services it provides across the country. It is important at this point, therefore, to outline the main objective of the bill. A directorate governance system in the HSE was put in place in 2013. As the Minister said when bringing this bill through the Seanad, this system allowed for coordination between senior management teams in the Department of Health and the HSE. But by its very nature and design and by intent, this was a system that was always envisaged as an interim measure. The time has now come, in line with Sláintecare recommendations, to establish an independent board governance structure for the HSE in place of the current directorate governance system. This is the core objective of this bill. The board will be the governing body of the HSE and accountable to the Minister for the performance of its functions. High standards of integrity and probity will be expected of the board. There are also central principles which must be at the heart of how the new governance model is implemented and which should guide the board. As the governing body, the board will support transparency and accountability of actions benefiting decision-making and management performance in the HSE. Part of this will be for the board to challenge itself as well as the HSE to show how the HSE is getting value for the public funds it has been given. Part of this will be to foster a culture of continuous improvement in the HSE. The board will act collectively so that all perspectives of patients, staff and the taxpayer are taken into account and will take decisions based on the public good. But in acting on these principles of independence and inclusivity, the board must ensure that fundamental values of care, compassion, trust and learning are well rooted throughout all services for which the HSE is responsible. Board members will be appointed by the Minister for Health following a public appointment service process for identifying suitable appointees. This process is a robust, competencies-based process and will see candidates being appointed to the board based on the skills and experience they bring to the board and their ability to engage in collective, complex decision-making. The board will have strong competencies across key areas, giving leadership to guide, challenge and support the CEO and HSE executive team, ensuring accountability and delivering organisational transformation within our health service. The public appointment service process ensures that members of the board will have experience and expertise in one or more of a range of areas including corporate governance, clinical governance, quality assurance and patient safety, patient advocacy, strategic planning and change management, business management skills, financial planning and management, strategic human resource management and public communications. I should also say that from the outset, patient advocacy was identified as one of the core competencies needed in board members. The Minister for Health was also clear on the Government's commitment to implementing in full the recommendations of the Scally Scoping Inquiry into the Cervical Check Screening Programme, including the recommendation in regard to advocacy and the new HSE board. This issue was also raised by senators as the bill passed through the Seanad. The Minister listened carefully to senators' concerns and reflected on the best way of delivering on the letter and spirit of Dr Scally's recommendation. The Minister therefore brought an amendment to the bill at report stage in the Seanad to provide that at least 2 members of the HSE board have patient advocacy experience or expertise. The Minister would like to take this opportunity to update the House on progress with identifying board members. In September 2018, after a demanding public appointments process, Mr Kieran Devan was selected as the Chair-designate of the HSE Board, and he brings to that role a range of skills, experience and leadership from his extensive experience of the British Council, in HS England and as CEO of Macmillan Cancer Support. The public appointment service process to identify the other 9 members of the board took place recently, and the Minister hopes to be in a position to make an announcement regarding the selection of the board shortly. I will now bring the House through the main provisions of this bill. Part 1 of the bill contains a number of standard provisions, including the short title and collective criterion of citation of the bill. It also provides for the repeal of Part 3 of the Health Act 2004, which instituted the Directorate governance structure. Part 2 of the bill allows for the required changes in the Health Act 2004 to reflect the structural changes proposed in the bill, in essence the establishment of an independent board and the appointment of a CEO to the HSE, and the values, principles and conditions which underpin this new structure. Section 7 of the bill proposes to insert a new Part 3b, Section 16N to 16U, into the 2004 Act, which contains provisions in relation to the membership and role of the new HSE board. Section 16N1 provides for a board for the HSE composed of 10 members, a chairperson, a deputy chairperson and 8 ordinary members, all of whom will be appointed by the Minister for Health. As I mentioned earlier, at least 2 members must be persons who have experience of or expertise in advocacy in relation to matters affecting patients. The appointment and functions of the CEO of the HSE are covered by the insertion of a new Part 4A, Sections 21A to 21G into the 2004 Act. As deputies will be aware, we are currently also in the process of recruiting a new Director General for the HSE. The successful applicant under this legislation will become the new CEO of this important national state body and will be a pivotal appointment in improving the management, performance and quality of our health and social care services. The legislation also sets the accountability structure between the CEO and Oireachtas committees. Under the new Section 21E, as provided for in Section 8 of the bill, the CEO of the HSE is required to attend before Oireachtas committees to give an account of the general administration of the HSE. The requirement for the CEO to appear before the Public Accounts Committee is covered in the amendment to the Health Act 2004 in Section 17 of the bill. Sections 9 to 29 provide for other amendments to the Health Act 2004, mainly consequential to the new board and CEO structure, and to take account of the move to a board and CEO structure from the Directorate governance structure. Part 3 of the bill has sections 30 to 34 and amends references to the Director General in primary and secondary legislation. As I have outlined, the primary purpose of the bill is to establish a board governance structure in the HSE to bring independent oversight. The Minister is also considering amendments to further strengthen oversight, accountability and to support a more structured and strategic performance dialogue between his department and the HSE. It should be stressed, though, that this bill, including any amendments to it, is a first step. The Minister is committed to continuing this journey of reform outside of the bill through ongoing work to review, refine and refresh the performance and oversight framework for the HSE. Before finishing, I think it is important to state that Sláintecare has placed the reform and transformation of our health services into a space that transcends party politics, because the importance of what we are doing goes beyond our political affiliations or ideological standpoints. It is about providing the people of Ireland with the best health service, a health service they deserve, one based on equity, professionalism and compassion, a health service which places the patient at the core of all that it does. The Minister believes re-establishing the board of the HSE is a key enabler of this and is a fundamental building block to strengthen governance and oversight in what is our biggest state agency. I commend this bill to the House.